Is the BCG vaccine necessary for TB prevention? Imagine a tool that can protect children from some of the most serious forms of tuberculosis. That tool is the Bacillus calmette-guerin vaccine, or BCG. It has been used for many decades to fight TB, especially in countries where the disease is common. The vaccine is very good at preventing severe TB in young children, like meningitis and widespread infection in the body. In fact, it can protect over 80% of children from these dangerous outcomes. However, when it comes to the most common form of TB that spreads through the lungs and affects adults, the picture is different. The vaccine's ability to prevent pulmonary tuberculosis in teens and adults is less clear. Studies show that its effectiveness in stopping lung TB varies widely and is not guaranteed. Because of this, the decision to use BCG depends heavily on where you live and your personal risk. In countries like the United States, where TB is rare, the BCG vaccine is usually not recommended for routine immunization. This is because the chance of catching TB is low, and the vaccine does not reliably prevent lung TB in adults. Plus, the vaccine can interfere with skin tests used to diagnose TB, making it harder for doctors to tell if someone is infected. Instead, these countries focus on finding active TB cases early and treating them quickly to stop the spread. In places with high TB rates, especially where children are at constant risk, the BCG vaccine is still very important. It helps protect children from developing serious disease and is part of the public health strategy to control TB. But even in these areas, vaccination is usually targeted at specific groups, like children who are at ongoing risk of exposure. Healthcare providers often check for TB infection with skin tests before vaccinating to make sure the person is not already infected. Ultimately, whether the BCG vaccine is necessary depends on your individual situation, local TB rates, and advice from health experts. It is a valuable tool in high-risk areas, but not a universal solution everywhere. Public health guidelines recommend a careful, targeted approach, balancing the benefits of preventing severe childhood TB with the limitations of the vaccine's effectiveness against adult lung disease. Always consult with healthcare professionals to understand what's best for your personal health and community safety.